So a little bit of history about the nurse practitioner profession in general. Going back for the nursing profession, nursing has been around for hundreds of years. We credit Florence Nightingale back in the 1850s for kind of initiating the profession and doing some standards of care that we still follow today. So way back in about 1870, the first nursing programs were started. They started in New York, Boston, and Connecticut. So we have a long history of nursing. You can see that the first nurse practitioner program started at the University of Colorado in about 1965. And about that same year, Boston College also started their master's degree program for nursing, which was probably more of an education-based to help with the education of nurse practitioners and moving forward. And I can only imagine the adversity that the initial nurses faced when they started this nurse practitioner program from the medical community. So it's kind of surprising to me, but we still see a little bit of that today. But moving forward, as more and more care is needed for underserved populations and communities, that's really where nurse practitioners are filling the gap. So you can see last year, we've had almost 900 million patients were seen by nurse practitioners, and a lot of those are in underserved communities because not that there's not as many physicians out there, but the physicians that we see today tend to be more specialized and going to specialties where nurse practitioners themselves are primarily trained in primary care. So you see a lot of us going into those areas. A little bit more history about nurse practitioner. So in the 70s, there were more than 65 nurse practitioner programs within the United States. We actually started one of the national nursing organizations, which are the National Association of Pediatric Nurse Practitioners, was established at that time. And then the American Nursing Association, who was a nursing organization which has been around from the late 1800s. They also developed the Council for Primary Care Nurse Practitioners. In the 1980s, another nurse practitioner organization was established, the American Academy of Nurse Practitioners, and then they were really integral in developing a national nurse practitioner database and also helping promote legislation on the national and state levels. In the 1990s, the New England Journal of Medicine supported nurse practitioners as cost-effective and quality healthcare providers. And then in the early 2000s, we aided and were instrumental in the September 11th attacks. At that time, the AANP also started doing some promoting research, evidence-based research, to maintain our standards of care that we still follow today. And then the nurse practitioners number actually grew from about 60%, from 82,000 to 130,000. And then just within the last 6 years, the AANP has been more active in healthcare policies, promotion of healthcare reform, Medicaid and Medicare regulations. That was very important and instrumental for us to see some of those underserved populations because a lot of them carry Medicaid and Medicare. So it's important that we can be involved in their care. They celebrated their 25th birthday, and then by 2014, we grew about another 50% to 192,000 nurse practitioners in the country. So what is a nurse practitioner? They are a nurse with a graduate degree in advanced practice nursing. We work in a variety of settings. We deal with acute and chronic illnesses. We do a lot of education and assistance in promoting health maintenance and wellness. And again, depending on what our specialty is, whether it's a pediatric nurse practitioner, I can treat from birth to 18 years of age. Nancy, as a family nurse practitioner, can treat all ages, but primarily she focuses on the 18 to advanced stage. Again, we're worked in, I guess I was wrong, wasn't I? We're primarily, we do a lot of primary care. There's also some programs that you can complete that are in acute care. Not too many in specialty care, but once you graduate, depending, you can find areas of specialty care. So most of them are pediatrics, family practice, women's health, and internal medicine. So again, nurse practitioners, we provide about 80% of our population are prepared for primary care, again, in family, adult, women, and pediatrics.
Okay, we'll go on and talk about the services that we provide in our respective areas. Nurse practitioners can diagnose and treat acute and chronic conditions in all age ranges of patients. At any age we can look at treating diabetes, high blood pressure, infections, cancer, numerous diagnoses. We can order, perform, and interpret diagnostic tests such as labs, x-rays. We can prescribe medications and other treatments to assist patients. We do a lot of counseling of patients for depression and some mental health issues. Because we look at the patient holistically, we don't just focus on maybe just an acute problem. We look at the entire scope of the patient and help with all problems that they have. We do a lot of education on disease prevention and positive health and lifestyle choices. And this is becoming more and more of a focus, looking at the prevention and trying to be proactive rather than reactive. Okay. We manage patients' complete overall care. Nurse practitioners, our perspective is to blend the nursing model of training and expertise with clinical training in diagnosing and treating all health conditions. And like I said, we additionally put a lot of emphasis on disease prevention, health promotion, and management. So here's the requirements that it takes to become a nurse practitioner. And we start at the bottom of this slide and work up. So first you have to go and get your undergraduate nursing education and degree, and that's a bachelor's degree. And then you have to sit for your state boards for nursing, and that's not an easy exam. So then you get your state registered nurse license, and you have that. Then you go on to school and get your graduate nurse education. This could be a masterate, or it could be a doctorate degree now that a lot of the programs are making so that the nurse practitioners only are doctorate programs now, kind of like pharmacy and physical therapy. We're all seeing that go in that trend. Then we have to take our national board certification, and that also is another rigorous exam, and then we get state licensure. So there's a lot to it, a lot of years involved. So a master's or a doctorate degree, so we have at least 6 years of nursing school to get this, if not more. Okay. We have advanced training in a clinical setting during our graduate training and all of our nursing training, and this means it's not just classroom focused. You have a lot of hours of clinical time that you're in various areas, say pediatrics, primary care, women's health, different areas of clinical training. A rigorous national certification exam, and then there's always, with all the professionals, there's continued learning and ongoing professional development that's required. Our licensure, the nurse practitioners are licensed in all 50 states and Washington, D.C. Each state has their own regulations of practice. So the scope of practice and the prescriptive authority does differ from state to state. And we just kind of wanted to show you an example. Okay, so this just gives you a little bit of an example of some various differences in what the nurse practitioners can do. If you look at, like Wyoming is here, we can do a lot more in the mid-northwest and southwest than some of these other regions. I mean, there's some of these regions that are very limited in what they can do. So we're very fortunate in our area to be able to have more scope of practice. Okay, why are NPs important? First of all, credibility. We're more than just healthcare providers. We're educators, we're researchers, we're mentors. We're involved in professional organizations. We help with health policy activities at a local, state, and national level. We help advance the standards that are involved with our practice. Lower healthcare costs. We provide high-quality care and counseling. Patients that see a nurse practitioner maybe are less likely to end up in the emergency room, have shorter hospital stays, have lower medication costs. Patient satisfaction. You can tell with 900 million visits by nurse practitioners a year, there's a high quality there of satisfaction with the care that our patients are receiving. And then probably the most important is the primary care shortage. We are able to serve those low income, or not low income, but underserved areas and rural areas that there's just not enough physicians to go around and take care of everybody. And that's going to just be more important as the years go on. This is the brochure that you guys have on your table, and it just kind of gives an overview of nurse practitioners. A couple things that we wanted to point out on this is just the increasing number of nurse practitioners. They figure by 2025 there's going to be almost 250,000 nurse practitioners practicing. And also NPs by number, we now can serve all facets of patients.
So nurse practitioners, as I said before, are definitely nurses first. Nurses are trained a little bit differently than physicians and physician's assistants. We use the nursing model, which is more of a holistic focus, not only as nurse practitioners on diagnosis and treatment, but also on kind of evaluating the lifestyle, the environment, and other things that we could potentially do to help improve the overall health and well-being of our patients. Not to say that physicians don't do that, but that's a little bit of a difference between the nursing model and the medical model. Medical model and physician's assistants, they do a lot of diagnosing and treatment. In Wyoming, and this kind of goes back to that other slide. So we're very fortunate in Wyoming that we can actually practice independently. Nurse practitioners carry their own license, so we are independently licensed. As I said before, it kind of just varies on whichever state you live in, the limits of what your scope of practice is. So we can practice independently without a supervising physician. The difference with the physician assistant is they are independently licensed. They take national certification boards just like we do, but they're required to be under supervision of a physician. So they don't quite have that independent practice that we do. We can do all the same things. They can diagnose, they can treat, they can order labs, they can order imaging, but they still practice under a supervising physician. And to clarify that a little bit, the West Park Hospital requires that all the nurse practitioners and physician's assistant have a supervising physician with those limitations, that a physician assistant still has to practice under the physician, where we can practice independently in collaboration with that physician, if you will. And so the advanced practice providers in Cody, there's currently 4 nurse practitioners in primary care, myself and Nancy, and there's 2 nurse practitioners at Billings Clinic. In orthopedics, there is 1 nurse practitioner, and there's 1 nurse practitioner that practices with one of our GYN physicians. West Park Hospital, as Nancy talked about earlier, moving forward in the growth of nurse practitioners in general. West Park Hospital is looking at hiring some nurse practitioners for a hospitalist position, which would be similar to mine, but they would work primarily in the hospital with the adult population, not the pediatric population. And then I believe we're also looking to hire another nurse practitioner for another GYN physician. So we are continuing to grow even in our little community. Urgent care has 2 PAs, and then the remainder of the PAs are usually in the orthopedic population with the other orthopods in the area.